Welcome back to Rekha's Healthy Aging channel. Healthy aging is in your hands. I'm a physical therapist with over 3 decades of experience in geriatrics and neurology. And I have a passion to increase awareness so one can go into your golden years running and ready to go. So today we're going to talk about the level 2 of balance. According to the CDC, 1 in 4 adults over the age of 65 have a fall. 95% of hip fractures are caused by falls, which can then lead to isolation and depression. And so there are multiple things we can do to improve our balance. So besides having our eyes and ears tested, our medications reviewed, we need to also work on tight, inflexible and weak muscles. So as usual, we will start today with a simple test. This test will be one step higher level or more difficult than the one I showed you in my level 1 balance video. Remember, none of the programs I show you is a one size fits all. You have to use your judgment, check with your doctor, or if you've had recent surgery, have chronic disease or chronic pain, please make sure your healthcare professional clears you to do the program. So today's test is called the tandem stand. As usual, as we are testing balance and you're doing this at home, it's very important. One size doesn't fit all, and make sure you're safe to do it. Stand in a corner so that you have two walls to support you in case you lose your balance, and you have the chair in front of you, which is a good solid chair that doesn't move. And again, we are going to be timing ourselves. So this time you can do it with one, but you should be able to do it with both legs. So what you're going to do, make sure you're wearing good non-skid footwear. Footwear is also very important for balance. So you have to place the heel of one foot in front of the toes of the other one. So this is called the tandem stand. And again, I'm pressing my timer, and it challenges your balance because you're narrowing your base of support again. So you have to maintain your center of gravity over this narrow base of support. And so if you can do this for 30 seconds with your eyes open, the more challenging version is to do it with your eyes closed, for which I suggest you have a family member there with you if you are up for trying it. But you can certainly do this with the walls behind you and a chair in front of you. And let's see what the timer says. I forgot to press the button. Okay, so now we're going to show the intermediate level of exercises. So since we showed the tandem stand today, that also makes a great exercise. If you were not able to do 30 seconds, which is considered normal, then you first practice just standing in one place for 30 seconds. If this was easy for you, then we'll do the dynamic version because this is static, and do it alongside the dining table in a safe place. So if you lose your balance, you have the table there, and you just walk with one foot heel to toe. The heel of one foot must touch the toe of the other foot. So you practice heel to toe walking, and you can just do 2 or 3 sets of this, and always in a safe environment, like I said, next to a countertop or a tabletop that's stable. So that's your first exercise. Last time we showed heel raises and walking on your heels. This time again along the tabletop or countertop, you walk on your heels. Last time you were doing heel raises. This time the toes are raised and you're walking on your heels. This is a very important exercise also because a lot of seniors lose strength in what we call the dorsiflexors of the ankle, which is the muscles in front of the ankle. So if you walk, it's challenging for your balance, but it also strengthens your ankle dorsiflexors. So that's your second exercise. So the third exercise is a side lunge. So you just fold your hands in front of your chest and you lunge 2 or 3 feet to the side and back. And you do everything to both sides. So this is the side lunge. Keep your back straight and you just bend at your hips and knees. And you can do a set of 8 to begin with. So this is the side lunge. Next, we will be doing the forward lunge. So I'm just going to turn sideways, and this time I will put my foot about 2.5, 3 feet in front of my hip, and then I just bend and come back. So you want to make sure that your knee doesn't cross your toe. Your knee should stay behind your toe, and you bend your back leg as well. So I'm doing all the repetitions with my right leg forwards first, and then you switch legs. So this is great exercise for balance and strengthening, stretching your hips and knees. Okay, now the last one is my favorite. It's called the mambo step. So with some nice music, what you will be doing is that you step forwards, lift the back leg, step back and up. So going to dance classes, doing some swing dancing or whatever kind you like is fabulous for balance and memory and physical activity and pumping up the blood to your brain. Now I'm going to switch legs and put the right leg forward. So you take a step and the leg that stays in place, you lift it up. So you're gradually getting used to doing a single leg stance, which when we come back to the level 3 of balance exercises, we will be doing testing at a higher level. So that's all for today, and next time we'll be doing a higher level of balance where we will do a lot of yoga postures as well. See you soon.